Hey everybody, and welcome back to the Tonic podcast. I'm Alex Kapitko, joined by my friend and co-host Drew Nepley. Drew, how are you?
Well, I'm doing good. I've been washing my hands. I've been trying to stay healthy, doing the do.
That's good. I guess that's all you can do. I am sitting talking to you guys in Madrid. Luckily, I live in the suburbs of Madrid, so stuff hasn't been quite as crazy. But bars and restaurants have been closed, and only supermarkets and pharmacies are open, and they request that people don't leave their houses. So we've started the lockdown. So I don't give too many Fs anymore about many things. Drew and I were just talking before we started. We have canceled our trip. Drew is planning on coming over in May, and it looks like that is not happening. And
No.
yeah, it just seems like the coronavirus, unfortunately, is impacting all of us in so many ways. So I promise you guys, we're not going to cover this every week. I know you're getting beat over the head with coronavirus news, but it's important. So today we're going to talk about it. And Drew, any first thoughts on, I guess, what's happened since last time we talked about it?
Yeah, I mean, last time we talked about it, it was still kind of mainly in China. We were talking about how, like that the Chinese response and the shutdown of Wuhan and the quarantine of millions of people, but it was far away at that point. It was, something happening in another part of the world. Well, now it's kind of hit home to everyone across the globe in a one way or another, especially here in the United States. We're up to currently at the time of this recording into the past the 2,000 range of cases, active cases. And I think it's going to be a lot more soon. And just right off the bat, the first thing that I noticed that is a huge change is the amount of people off work or working from home. So me personally, my company is a media company in Los Angeles. We had a mandatory 3-week work from home that was started this last week, in mid-March at the time of this recording. And so I've been working from home the last 3 days, and I got a lot more time to work from home. So the next 3 weeks, I'm going to be chilling in my jammies, drinking tea and working from home. So, but I think that's first of all, I think that's just a major big change. It's the first time that, this coronavirus is not just a headline on CNN anymore. It's actually affecting my day-to-day life. And I've been working from home.
Yeah, I think that's something you hear a lot of people talking about right now, is at least in the United States and Europe, I think people are going home. And in China, obviously, we saw that as well in, the province of Hubei and then Wuhan, leading up to the giant quarantine they put throughout the country. And yeah, it is interesting to see. And so tell me, have you enjoyed working from home more than being in the office? Like, what is the big difference for you between those two dynamics?
Well, the one is I love not having to drive. I mean, I drive on a freeway in Los Angeles every morning, and it's not exactly fun, to put it lightly. So I've been really enjoying the fact that I don't have to commute on a freeway every day, and I'm saving an hour of my day I can sleep in longer. And then wake up right before I get to work instead of having to give myself an hour and a half to get ready and drive. So that's the main thing is I like getting more sleep. But I can also tell you that just because of the setup I have, I'm just using a small laptop, whereas when I'm in the office, I have the laptops hooked up to monitors and keyboard and, fast business internet. So there's a little bit of a limitations as far as the work I can do on my laptop, but it's not enough to stop me from working, right? And that's just the nature of my own industry. But I could probably I could work at 90% capacity from home. And it is telling that, I think we might start to see more companies adopt more lenient work from home policies. I know just in general, that's kind of been the trend. My own company didn't have a work from home policy until about a year and a half ago. And then we got one where we can, kind of take 1 day a week work from home. It's flexible depending on your other schedules and stuff. And now with this, I think a lot of people are going to get used to the idea of working from home. In various companies that it might have a lasting impact. Now, it might not be the kind of thing where everyone just works from home all the time. I'm not saying that. But it might be the kind of thing where more companies offer the option to or increase the amount of hours you can because, that's just kind of the direction it's going. And especially with apps like Slack and Zoom. My company uses Slack. You can do a lot of the things like even meetings, you don't really need to be in the same room anymore. You can just meet on Zoom and get the same information.
Huh. Yeah. No, I think it's a really interesting thing that we're seeing with this whole pandemic. And I guess I'll go right into it since you kind of brought it up. I think this is one of the lasting repercussions we're going to see from the coronavirus. It's just a change in how businesses and workers have a relationship with one another. And I think it's an interesting point, and the Economist had an interesting research study. I think it was from back in 2014, where there was a metro strike. And by the way, this has nothing to do with the coronavirus, but it's an interesting comparison where in 2014 there was a metro strike in the London Underground, and it reallocated everyone's days where people, had to adjust their schedules to get to work on time. And researchers at Oxford found that after this happened, about 5 to 10% of these passengers stuck to their new itineraries. And so I guess the point is that sometimes when you're put out of your comfort zone and you have to change how you work and how you get to work and how you manage your day, sometimes the outcome's better.
Right.
And I think that's kind of what we're seeing now, at least in some jobs. And later I can also get into the negatives. But it is true that, say, if you're a single mom or even a mother or a father, you don't have to spend your morning just commuting. Maybe you can stay home and help your kids get to school. Maybe there's more time to be healthy, get sleep, as you'd mentioned. I think there's a lot of side effects that in the long term could be good. And, unfortunately, it's not the perfect time to do it, but a pandemic does kind of force us to look at change,
Right. I mean, let's not forget that the United States is one of the few, developed Western nations that doesn't have a mandatory sick leave, right? Other nations have a mandatory, if you're sick, you have to pay out people so that they can not work to prevent the sickness from spreading. That's not a thing, right? That's an option that companies provide, but most don't. And I think this coronavirus is kind of showing the weakest links in our healthcare system. And one of that is that, we don't have a mandatory paid sick leave. And so some companies have adopted it, right? I think Walmart and Starbucks are now offering paid sick leave for the first time to some of their employees. And it's just, and I'm glad that they're doing that. But it had to take a pandemic to force the United States to kind of realize they're kind of behind other nations as far as paid sick leave, because I think it's pretty safe to say that public health issues is a public concern, especially when you have a virus that spreads. It is not about this whole notion of it's just between you and your doctor anymore. I think that's a notion that a lot of Americans used to have, is it's my health is between me and my doctor, and I'll pay the doctor, and that'll be that. Well, no, we live in a very globalized and interwoven world where someone's health on the subway can then affect hundreds, if not thousands, of people around them. So we need to have things like paid sick leave, safety nets in place that if a pandemic like this arises, you're not going to have people struggling or freaking out. And unfortunately, we kind of are having people struggling and freaking out. But then, but as we're saying, on the other hand, it's also waking some companies up to the reality that, hey, maybe we need to start paying people sick leave and maybe start allowing for more work from home. And thankfully, I'm personally in a position where I can work from home with an office job, but not everyone's in that position.
Right. And I think that's a very, very good point there, is that a lot of people don't have that luxury. But it's true. I think going back to the first thing you said is that, unfortunately, I think a lot of humans, and I guess corporations, don't usually see the forest through the trees. And sometimes it takes, unfortunately, a large international incident to kind of bring us to the table to actually want to reconfigure how we do things. And that's in every aspect of life, I think, you could even use health. So, if you get terminal cancer, maybe you want to start turning your lifestyle around. Sometimes too late, but sometimes it takes these large events to actually,
right,
make that synapses in our brain go off. And I think we're seeing that right now in a lot of ways. And I was reading an interesting article in The Economist again. I know I talked about The Economist a lot, but this was a pretty nice one. It was called "Throughout History, Pandemics Have Had Profound Economic Effects." And it talks about two examples in particular, the Spanish flu and the plague, which I think most people have probably heard of, I would imagine. But they used the example of the Black Death, in which 1 or 2/3 of Europe's population was killed. But the actual scarcity of workers following it gave laborers bargaining power, and eventually it caused the breakdown of feudal Europe,
wow,
which is actually quite fascinating. Obviously, it's not good when 2/3 of Europe potentially died. But this shortage of labor actually gave laborers the fact to say, you know what, we don't like being treated like garbage, and it's time for us to stand up and get some form of a social contract or a labor contract. And I guess if you do look at the trends of history after the Black Plague, you did start to see kind of a reshaping of Europe. And then the Spanish flu was the same, where in the United States, according to Mark Siegler, I think that's how it's pronounced, he's a California State University professor. He said that the American states that were hit the worst by the Spanish flu saw the largest growth afterwards. So it's kind of interesting because I think this coronavirus is going to force us to embrace new technologies, new means of work, as you said, with working from home, education, which I do want to talk about later, and then also, like you've said, healthcare, which I think is interesting because we're in the middle of a hot election cycle, and I bet Bernie Sanders is kind of looking at this going, I told you so, to a certain extent.
Right.
And part of me says, yes, I think if we did maybe go more towards a single payer system, it would help. But this does hit home for me a little bit because in Europe, where I'm at right now, I do know a Spanish family who has a company, but it's an autonomous company, and their employees are not technically state employees or not covered by the state. So unless they actually have the coronavirus or in bed, they cannot work from home and still be paid if the company had issues and all of them had to go home. So even in these socialized countries, I think the issue is becoming bigger than just, paid sick leave and having access to any doctor, because also, as we've seen, the system has gotten overrun in northern Italy and pretty much all of Italy, and now in Madrid, where it's not really the issue of just being able to get to see a doctor without high costs. It's more the fact, can a doctor even see you and help you when there's 10 other people that need help, So I think that's why this system is not only pressing the U.S. medicine in general, but I think it's also showing us that the European model isn't perfect either.
Right. Well, it shows that we have to be like, we have to more take it seriously and be prepared so it doesn't spread too quick, right? Like, that's the thing. It's the shock to the system. No matter what healthcare system you adopt, if you just have a massive shock to the system, it's going to be rough.
Right.
If you have a massive uptick in cases super quick, that's why it's so important that we have accurate and consistent messaging from trusted officials that can give, to reduce the panic, make people take it seriously, but reduce panic so that we can limit the number of cases at a certain time and kind of, flatten that bell curve like you've talked about before. And so I don't know. I do worry that the United States has been kind of like, I don't know, a few weeks ago, Trump was talking about it was a Democratic hoax. And now it's a real national emergency. I just wish that our messaging from the government officials was a little more consistent.
Yes.
Because I also think people are panicking. I mean, we have to talk about it a little bit. I mean, these people buying pallets and pallets of toilet paper. It's ridiculous.
Yes.
There's no indication that this virus will have any impact on the supply of toilet paper. Like, I don't, so I don't know why people are freaking out. Like, I get that if you think you're going to be quarantined and can't get some, I don't know. It seems like it's just panic buying. Because again, the stores aren't closing their supplies. Their supplies are still there. And there's a ways around going to a store and buying it. You can have, Walmart does some deliveries in some places where you can, have it delivered to your front door, or you can drive up and just pick it up at the front. When you minimize human contact, you can still get your groceries. So I don't know why people are panic buying, but that's the thing, is there's this panic that's going around that I don't think is really well informed, and it's causing weird issues. Like, my grocery store's toilet paper is completely gone, ransacked for no reason other than just people think other people are getting it before them.
Yeah, it's funny, and this is an issue that goes beyond borders, because I think I've seen pictures from about every country that's been affected by this, and it's all the same, And
yeah,
I mean, just to get the facts straight here, if you're going to panic buy anything, panic buy necessary medicine, because most medicine is made in China, and there is a true shortage of certain elements that are necessary in certain particular parts of different medicines. And so if you're going to stockpile anything, talk to your caregiver about getting more of your prescription. Also, I don't think hand sanitizer is this necessary just bulk buy, but I would probably rather buy more hand sanitizer than toilet paper. But But I mean, back to what you originally said is yes. I mean, talking about U.S. politics and this for a second is, I think this is going to be interesting for both Democrats and Republicans. And I'll start with Republicans because just to kind of respond to what you had said, is that I think this whole crisis is making Trump look quite bad, and I think there are going to be Americans in the middle, especially, that are probably not going to vote for him because of how he's managed this situation and still is managing this situation. I think a lot of us just want a safe, secure leader who can go up in front of the mics and tell us, maybe this is bad, maybe this is serious, but we're prepared and you need to be prepared. But the mixed messaging, like you said, it's just ridiculous and it's not necessary. And the problem is a lot of the people that listen to him are older Americans who actually need to take some of this advice more seriously.
Right.
They're closing public events in almost all the states. I know more strongly in Washington and California, and Trump still, was still holding rallies until recently. And the people at his rallies are probably not people that need to get sick with this virus. And it's just kind of sad. And at least I've never been a fan of Mike Pence, but at least he is going around, and obviously we can debate all day whether or not he should be the one streamlining this effort. But at least he is going on talk shows and being a little more direct with the American people. And politically, I do not like Mike Pence, but I do think that it's nice to at least have someone that's trying to explain to us what's happening, which clearly Trump cannot do.
Yeah. Yeah, at least there's someone now that is giving consistent messaging and seems like he's actually listening to the experts. And the consistent messaging is a problem because Trump did a travel ban of Europeans to the United States for 30 days, and at first it seemed like that included industries, right? Like shipping and stuff, and based on his speech. But then after the White House had to clarify that it didn't include industries. And so that kind of thing, like, again, I understand people make mistakes, but when you're giving like an address to the nation about a crisis, you need to be very exact and clear about what your policies are. And to have these misstatements with something so important as trade with Europe closed for 30 days, like, you can't mess up. And that's the thing. I think that is what it's showing is Trump has had some crazy stuff happen to him in his presidency, with impeachment and all these scandals, but he hasn't had like a national crisis like this. Like, he hasn't had his 9/11 or his Katrina until now. And I think now we're really seeing how ill prepared he is for something like this, where he needs to unify the people and he just can't do that. And he needs to give like a fireside chat to inform people about what's going on. And he makes misstatements. The fact that you just said, look, like the stabilizing beacon in the White House is now Mike Pence. It's not Donald Trump. It's very telling. Again, I'm in the same boat. I'm not a huge fan of Pence personally, but he is the one now that is being the most calm and the most responsible in the White House, and that just says something to me.
Yeah, no, it screams to me, and I think that's a good point, is that this is Trump's first crisis, because all the other newsworthy crises that Trump has had have all been from his own doing. This is the first one that is from outside influence that he actually needs to be a leader and spearhead. And I mean, we can even see it in the fact that it was only on Friday that he finally was down to get a coronavirus test after there were reports that he was around multiple people that were infected. And then Jair Bolsonaro, the Brazilian president, got it after meeting with Trump in Mar-a-Lago. So I just think it tells you a lot when the president, who potentially could have had coronavirus, and I guess it's coming out he didn't have a fever, so I guess we're looking good. But the fact that he could have had it and was too cocky to get a test early on, it pisses me off. It's like, this is just so ridiculous. And
yeah.
And I'm curious to see how Bernie and Biden respond to this, because there's a lot of fuel. There is a lot of fuel that can work well for them.
Yeah.
And I think both the right and the left almost completely agree that his speech, on my schedule's all screwed up with all these days not being at work. I think my schedule, it was Thursday he gave the address. Yeah. I think both sides have kind of just agreed generally that was a bad, unnecessary speech, and I think this is going to benefit Biden just by every magnitude possible, because he obviously is a gaffe machine, but he's a nice guy that could probably be honest with the nation. But and I am curious just politically because we've talked about Medicare for all a little bit, and I'm curious if he's going to try to adopt a more progressive plan in the height of what is happening.
Right. Well, he won't say Medicare for all. He definitely won't say those
Of
words.
course not.
But he would. But he would say something like, like he'd be like, we need to have mandatory sick leave, and we need to, waive co-pays for those in pandemics. All the things that make complete sense to me. That in fact that even Mike Pence and the administration are doing. I just saw recently that Mike Pence is working with health insurance agencies to waive the cost of getting the test to get the COVID-19 test. They're saying, you won't have to pay for that if you're getting tested. You still have to pay for the treatment, but you won't have to pay for the test. So that's so even the Trump administration is at least like, all right, we got to start waiving some of these financial barriers to people getting tested because, you can't have that. If you're trying to limit a pandemic, you can't have people not getting tested because they can't afford the $80 copay. Right. Yeah, if I was Joe Biden, I would hammer in on stuff like that. You're right. I would hammer in on how ill-prepared Trump is. And I think Bernie Sanders will too. Bernie Sanders is going to be like you said earlier, look, I told you so. Medicare for all would have solved this. That's debatable, but he'll certainly say it. Right. Yeah, Trump has not handled this well, and especially because the stock market too is crashing. We had on Thursday, it was the largest drop ever, I think, in a single day. It rebounded a little bit Friday, but it's still, we're in a bear market now, and that is not good news for Trump, who has touted the stock market as his kind of his end all be all factor of success. Right. And again, it's so obvious that he cares about optics, right? He's talking about, I like the numbers are low. I like the numbers where they are. And every disease and control official was like, hey man, these numbers are not going to stay where they are. We're letting you know that these numbers are going to go up. And so he wanted to do everything he could to keep the numbers down, but it's like, no man, it's going to go up. You need to prepare people with the reality, not just the optics.
Right. And I mean, Trump is Captain Optics, right? I mean, his damn name is all over his buildings. Like, right. It's going to be hard to change that as a over 70-year-old. But, actually, I think it's an interesting point, the numbers, because I actually do want to talk about the numbers for a second of this, because it's more just something I feel like I just need to say because there's so much misinformation out there. And it kind of goes back to what you said. Well, Trump said that I like the numbers. And then he's also joked about keeping people on a cruise ship because it's better for the numbers. Right. I mean, I first want to, I think that is despicable because more and more studies are showing us that it's the airborne droplets in a closed space that are the most infective. Obviously, washing your hands is fine, but if you're in a closed area with someone who has it, not a good situation. So trapping 700 people on a cruise ship, that is a rare form of torture, because I think if you get those people off right away and quarantine them, there's a lot more likely chance, they're not going to get it. Yeah, but like I was going to say, so Trump likes the numbers. So this is according to The Economist and the Pew poll that says basically that if only 1/5 of the population fell ill, and this is a very generous number, if only 1/5 of the population fell ill, and the virus had close to 0.5% death rate, that would lead to 327 deaths, which is 9 times more likely than the flu. And that's very generous because a lot of other people think the death rate is between 2 and 3, and that close to 40 to 70% of the population will fall ill. So obviously those deaths go into the millions really quickly. And so that's something that, because I've seen people all over the time on Facebook posting stuff like, well, Ebola killed more or had a higher death rate, and H1N1 had a higher death rate, and MERS and SARS had a higher death rate. Okay, yes, it does have a higher death rate, but when it's very transmissible, it's just a numbers game. If 70% of the U.S. population gets infected, but it has a lower death rate, still more people are going to die. And I don't think enough people understand that. And that's why the Spanish flu, for example, was so severe, is because it also didn't have a crazy high death rate, but it just destroyed the healthcare systems and it slammed hospitals. And that's a very deadly combination. Right. So when Trump comes out and says, I like the numbers, we're fine, but every healthcare professional who works in it says, actually, I probably wouldn't take a flight. And no, we should definitely change some things. It kind of concerns me.
Yeah, absolutely. I mean, I've seen some anecdotal posts on Reddit from healthcare professionals. And again, this is an anecdotal post on Reddit, so I'm not taking it as 100% fact. But I've seen a multiple, right, on people saying, hey, I'm a healthcare professional, ask me anything. It's not looking good. They're saying that, People are showing symptoms in hospitals that look like COVID-19, and they're not getting tested, and they're not getting approved, and so again, I don't even think our numbers are accurate. I think
No.
I saw something. I think I saw something where the team, the Jazz, right, where or I think now two of the people on the Jazz, the basketball team, have tested
Yeah.
positive.
Uh-huh.
The Jazz tested like 58 people in the last week, and the CDC tested 70 in the last week. So it's like, how is the CDC only testing 70 people in the last week compared to a basketball team that tested 58 people? So I think our numbers are drastically unreported. And again, you're right. It's this, we don't have the ability to have a draconian shutdown like China did. And we have kind of a muddy messaging that, yeah, I think a lot more people are going to get infected. And I do think, like we talked about earlier, I think it's going to have a fundamental change on the way our society views some things like work, like sick leave, and like healthcare. I think now healthcare was already the hottest topic on today's this election cycle, and I think it's just going to be even more so.
Right. Right. No, I think that's an interesting point that we are going to see. I think we're kind of at a weird time in 2020 where we've had a lot of different viewpoints that have been bouncing around. We've had a lot of kind of building crises, and I think this is the one that's kind of been the nail in the coffin. It's been the catalyst for change, if you want to call it that.
Right.
But back to what you said about the NBA, it is interesting because I listened to The Herd with Colin Cowherd, one of my favorite sports podcasts out there. And yesterday they didn't talk about anything but the coronavirus, obviously, because pretty much fun is canceled.
Yeah.
But the Utah Jazz thing is interesting because yes, two players positive. You had Rudy Gobert, the first one who got it, out rubbing microphones, joking that he had it, and then karma is rough. He ended up having it, and yeah, that apparatus on that team tested everyone much more effectively than the CDC has. But what I find interesting about this case is I think it's very telling on a positive note for most Americans is that of, what'd you say, it was 58 people tested?
By the Jazz, yeah, something like 58.
No one else came down with or was diagnosed with the coronavirus except for these two. And so first, I think that tells us that maybe the transmissibility is still hard to quite pinpoint. And second, both of the players, including Gobert, who have come down with it, have said they're okay, they're doing fine. And I think that is an optimistic note to see that the whole team didn't get it, first off. And second off, these guys are not in critical. And obviously, these are sports specimens. These are modern gladiators.
Yeah, these are super fit, athletic guys.
Right, right. But what would have been more worrying for me is to see, 25 out of the 58 ended up positive.
Right.
Or maybe one of the two of these players, like Gobert, is maybe in the hospital with severe pneumonia. And at least on a positive note, we've seen that. I mean, I think Tom Hanks was similar. I haven't followed his story as closely.
I think he's fine.
But at least, yeah, I think he's fine. So obviously these are wealthy people with a lot of good resources, but also Tom Hanks is older, and he did look good from the videos I saw, which is promising.
Yeah. I mean, it's just one of those things where it's like, again, like I'm not personally worried about getting it myself. But it's the implications for, older people, my older family, but then also just, the implications for how society is changing. Like, it's a big moment. This is a big moment in the world. This is one of those history book things. You're going to look back at, like, major pandemics through history, and this is going to be on it, the coronavirus. And I think we're still in the beginning stages. So some some positive ends is the amount of new cases in China are dwindling down really rapidly. South Korea is having more recovered than new cases. So it does seem like it's in some parts of the world, it's not getting completely out of control. I think in a year's time, we won't be talking about this, hopefully. So, there are some positive silver linings, right? About like, it's not going to be the death of society, but it's going to change it. It's going to change it. And in some cases, especially in the United States, it may push people to change it in a better way, I think.
Right. No, that's a really good point. And I mean, even as of yesterday, I saw that in northern Italy, I think reported cases were on the decline, which is good to see. And I think it does show us that there's one method or formula we need to follow, which is lockdowns. I know it's not a popular idea, but I think the closure of restaurants and bars and public spaces is is crucial. And because
Right.
we have seen recovery in every nation. I'm not gonna put Italy into this because they still have a looming crisis ahead in so many other ways. But I think we do see that when the government comes in and takes control in these sort of phases, it is more beneficial. And the problem is in the United States is that it's such a decentralized country, and it's so big on the scale of just total size that I wonder if we could do the same thing, and also I wonder if Americans would let them do the same thing. I mean, these are people that joke that if you come and try to take my guns, I'll shoot you. So how are they going to feel when the government tells them they can't leave their house?
You're right. They can't go down to the bar. They can't go stock up on toilet paper. Yeah, I think it would be very difficult to have a kind of a nationwide lockdown. I mean, obviously, municipalities can do their things, right? Close schools or whatever, which they've done. But closing schools is a lot easier than closing bars, right? Private businesses that depend on, small businesses. To keep people away from small businesses, it's going to be next to impossible. So yeah,
Right.
without draconian measures, which don't fly too well here in the United States. So yeah, it does show that at some times you kind of need some strong government control, but then in times where you don't, outside of the crisis, you need some strong limits on that government control. It's a tough balance. It really is a tough balance. But the coronavirus has definitely woken us up to a lot of issues. 20% of low-skilled workers have paid sick leave, so 80% don't. And I think in the future that'll change, and I hope it does. But to all those listening, don't panic. There's no need to stock up on toilet paper, but it is, you might have to cancel a trip to Europe like I have. You might have to buy some Purell and wash your hands, and you might want to stay away from major gatherings.
Right. Right. And I mean, the one cool note I could also say to end us on something positive is that, the NBA season has been suspended and I would think most likely canceled.
Man,
But a lot of sports.
Just
Yeah,
when the
go ahead,
Lakers
sorry.
were getting good, just when the
I know.
Lakers were getting good.
I know, man. I was just thinking that. I'm like, I mean, Kobe dies. LeBron is having a crazy good season, and they are finally looking like a championship worthy team. To redeem their name and fight for Kobe, and then this happens, But the one positive thing, though, is I think the NBA season is too long, and a lot of sports analysts for years have been talking about how to restructure the season.
Mm-hmm.
And again, we're talking about how sometimes these pandemic can be a catalyst for change. I think we're going to relook at how long a season needs to be, and we're going to relook at just certain aspects of how we force players to the extreme and to deprivation and whatnot. And so I think that's going to be interesting. And I mean, also in the NBA, there's been some good things like Mark Cuban, the owner of the Dallas Cowboys. He's working on a way to keep playing. Sorry, not keep playing. Keep paying employees that are on hourly wages at the stadiums, and that's cool. I like
Right.
to see that and other NBA players have offered to use some of their salary to help these hourly players. Like we're seeing good people rise out of this. I mean, Bill Gates and them are working on getting test kits quickly out there. I think that is one of the positives of crises in every type is that you see people with the resources at the end of the day try to help, and I think that's cool.
Yeah, I forget who has this famous quote, but it was always like, I think it was, I don't know if it was Gandhi or Martin Luther King Jr., but I'm butchering it. But there's this famous quote that's like, in a time of crisis, always find the people that are helping. There will always be good people helping others. And actually, I think it was Mr. Rogers. Anyway, in a time
Tom
of
Hanks.
yeah, in a time of crisis, always, if you're always scared, there will always be people out there helping others and look to them. And I think that we're seeing that. Mark Cuban is an example. And so yeah, and those people will have a lasting image and an impact, and I think that's great.
Mhm.
All right, well, folks, another part of this crisis is the economic aspect to it, and part of that economic crisis aspect is a little bit to do with an oil war, which we'll get into in the next episode. So a little bit of a tie-in there. If you're interested in the Russia and Saudi Arabia oil war, stay tuned in the next couple of days, and we'll get you back with another episode and how that ties into this volatile economic market we live in. Thanks again for tuning into the Tonic Accord podcast. Anything else you want to say, Alex, before we get out of here?
No, just keep sane. I feel like there's a meter between panic and calm, and I don't like talking to people on either side of that. The people that say, "Don't worry, it's just the flu." It's not the flu. And second off, don't panic. Don't buy everything in the store. Things are going to be okay. Just be smart and use
Yep.
your social responsibility. Don't hug your grandma. Maybe FaceTime your grandma.
Yeah.
Stuff like that. Okay? I mean, just be smart and sensible, and don't burn down the local Walmart.
And don't resell toilet paper for $100,000 like some Canadian family did last week.
Ugh,
No price gouging.
Jesus.
That's a little unethical. All right, folks. Thank you again for
Just a
tuning
little.
in. Yeah, thanks again for tuning in, and catch us later this week for our episode on the Saudi Arabian oil war. Take care.